Approximately 3,400 infants die from sudden infant death syndrome each year. That's according to the Centers for Disease Control. Safe sleep for infants is crucial. That's why we have Dr. David Rzeszutko with Priority Health here to share guidelines on how to keep your baby safe. Thank you so much for being here with us.
Thank you for having me.
So just talk more about this month and the importance of having these conversations.
Yeah, very important. The American Academy of Pediatrics has put forth a number of publications specifically about safe sleep, particularly for infants, in addressing sudden infant death syndrome.
So some people may have heard the term back is best, but there are a few other safe sleep tips that you can share, right?
Yeah, so for a number of decades, we've actually been recommending back to sleep. But there's a number of other things that we should be doing in and around the environment that baby sleeps in. The first biggest thing is the bedding that baby is on, a nice firm surface that has a nice fitted sheet associated with it. And you really want to avoid any extra things in the bed along with the baby. So blankets, things that are like plush toys, stuffed animals, things like that, that all can cause either a choking hazard or compress the airways of the baby. Those can all be problematic during the time of putting baby down and sleeping.
What are some common sleeping practices that are not considered safe sleep?
Yeah, so there's a number of things that are on the market that are actually marketed to help with baby's sleep. Things like bumps or other positioners, not really recommended, because again, those can all sometimes result in obstruction of the airway and affect the baby's ability to just oxygenate. The reason that we want to use a back to sleep or putting baby on their back is because children and infants don't have the muscle control and the tone and control to be able to reposition themselves if they do get their airway obstructed. And so if a baby is okay, or if they flip over, and because there's a lot of folks that say, well, you know, I position them on their back and then they flip over or they roll. If they're strong enough to get into that position, then it's likely okay, but we just certainly don't want to be supporting side sleeping or using bumps. A lot of times folks will grasp at that because they're concerned about baby vomiting or being a little bit more spitty or irpy, so they're a little reticent to use back to sleep, but that's not the recommendation from the AAP.
And Dr. Rzeszutko, when it comes to technology, parents should really be, talking to their doctor about that and asking questions.
Absolutely. Be very mindful, because there are a number of things out there that may be touted to reduce the incidence of sudden infant death, but there's really nothing that's been proven to impact that. Back to sleep, breastfeeding, want to make sure that we're using a good environment, as I mentioned, avoid smoking in and around baby. Those are the tried and true methods and the things that we should be focusing on.
Does Priority Health have anything directly to support the health of moms and their baby?
We've actually got two really, really great programs. One is called the Maternal Infant Health Program, that's specific for our Medicaid moms and families, and that's really in-home visits. It's a ton of support and education, kind of supporting that healthcare pregnancy journey to make sure that we do get to full term and reduce low birth weight and low birth weight babies. And there's another program for our commercial members called Priority Mom, and it's doing basically the same thing. A lot of education and resources for moms on that journey, because it can be sometimes a little scary when you're not sure what to expect.
I know, I was going to say, being a new parent, that can be a little scary, right? Not knowing, and especially during bedtime, right? And your best advice, any tips that you want to share, words of encouragement, Dr. Rzeszutko?
So if you have questions, please ask. There's a ton of resources out there, whether or not it's a trusted healthcare provider. Priority Health has a ton of resources always. You can reach us all the time at 1-800-PRIORITY-HEALTH.
And parents should really be having conversations as well with the people who care for their babies, as well.
Pediatricians, exactly. Even family members.
Yeah, family members, right?
Sometimes can help. And if you're feeling like you're not getting your questions answered, go with your gut and seek out more information.
Okay. Anything else that you want to share, Dr. Rzeszutko?
Don't suffer alone, and ask questions.
Okay. Thank you so much for being here with us.
My pleasure.